Hello, and welcome to another episode of the Edmonds Mom's Room podcast. I am your host, Dr. Allison Feldt, and owner of Body Motion Physical Therapy, entrepreneur, mom of 3, and lover of life. I'm just gonna throw in new adverbs or adjectives every time I go live now. Anyways, thanks for joining me on this episode. We are gonna talk all about introducing you to your body. Now, a lot of people are aware of their anatomy, but a lot of people are not aware of their anatomy. So I thought, what a fun episode to break down the actual ins and outs of our pelvis. Like, what is our pelvis consisting of? And let's not make it a private part anymore, right? Like, it is so taboo to talk about the vagina. It is so taboo to talk about the pelvis itself. And we're breaking that mold, right? That's what this podcast is all about. That's what pelvic floor physical therapy is all about. We are empowering you to be strong from the inside out. And so I need you to know about your body. And this episode is going to cover everything about your pelvis that you should know and need to know. And maybe it's going to help you educate your young daughters at home so that they can be empowered about their anatomy and embrace their own pelvises. Because if we can learn to embrace our pelvises and embrace our vaginas and our vulvas and not be ashamed of them, maybe, just maybe, we won't be holding them so tight, so constricted, and be so turned off for so many freaking years. Okay, so that's how I'm introducing this podcast. What an episode it will be. Now, I will tell you that this might be easier to follow if you are watching live on YouTube. We will, of course, have it on Spotify and Spreaker and everywhere you get your podcast, but it's probably going to be a little bit easier to follow this episode if you are watching live or watching it on the YouTube air. If you have questions, drop them on the YouTube in the comment section because I will go in and answer these questions for you. We're going to get nitty gritty. We are going to talk about the pelvis, and hopefully by the end of this episode, you will feel like your vagina, your vulva is just as special and not off limits as your freaking knee, okay? Like, let's get that just all one and the same. The vulva, the pelvis, it is the same as the knee, except for actually it has so many functions. And it has really cool functions, so let's talk about it. Welcome to your pelvis. So if you're watching, I am holding a pelvis here. The pelvis is 2 hip bones. They're called ilia and a sacrum. They create your pelvis. Attached to the pelvis, you have your lumbar spine up top, and you have 2 femurs that create your hips and your hip sockets down on the side. And guess what? You have pelvic floor muscles that attach to these femurs. You have pelvic floor muscles that attach to the sacrum, and that is your pelvis. Your pelvis is just like your knee in the fact that it's just soft tissue. You have muscles around it, you have tendons, you have bone, you have nerves, you have lymphatics, and you have blood flow, and that is really cool, right? So many people come to us and they're like, they're worried about how their vulva looks. It's really common after you have babies to be like, oh, my vagina looks weird. It feels different. And a lot of times people are like, they want these like porn star vaginas. And the reality is like every vagina looks different. Just like every face looks different. People have different noses, they have different mouths, they have different ears, and that's beautiful, right? Vaginas look different. People have different size labias, they have different size clitoris, they have different size openings of the vaginal canal, they have different sizes anus, they have different folds of their tissue. Some people have more fat tissue, more adipose tissue in the actual labia itself. Some people don't have much. Some people just have a lot of skin in that area. And it's all normal. Like, that's the thing. Like, people just look different just like they do on their faces. And so, and I know people aesthetically will do like lip filler or they'll do Botox in their face. And so it has also become common to do things, to do like vaginal plasties where you change the structure of the vagina to make it look more porn star-esque, I guess. But that's just not necessary. What is necessary though is that you know what your vagina and what your vulva is and how it functions. So welcome to your vagina now. So we went to the pelvis. Now we're going to go to a part of the vulva, which is called the vagina. So just to be clear, the vulva is this whole area, including the labia, the vaginal opening. It includes the urethra. So the urethra usually sits right above the vaginal opening. However, some people's urethras are located inside the vaginal canal and at different parts inside the vaginal canal. It's just an anatomical difference. People are going to be different. And so the urethra is just that teeny little opening that you urinate out of, so where you pee. And again, that is a separate opening than the vagina itself. Now, on top of the urethra, right above vaginal opening, then you have urethra. On top of the urethra, we have your clitoris. The clitoris is made up of these superficial muscles that are called bulbar cavernosus and your ischiocavernosus. The clitoris is composed of what's called the glands of the clitoris. So it's like this little... it just looks like a penis, and it's made out of that thing called corpus callosum. And then you have these crus of the clitoris, which just lay underneath this first layer of the pelvic floor muscles. And then you have the bulbs of the clitoris. So these they're like little vestibules that sit underneath the clitoris. Now, those aren't visible to the eye. Usually all you can see with the clitoris itself is like a little ball with like a teeny little hood on it, and that has over 10,000 nerve endings, and if you stimulate it, it should feel pleasurable and good. Now, for some people it doesn't feel pleasurable and good, but just like any muscle, you have to train it in order to get it to work. So for people that have never experienced orgasms, they might have dysfunction in these pelvic floor muscles. They might be keeping these pelvic floor muscles very, very tight. They might not know how to open up these pelvic floor muscles or to utilize them. And so then stimulating the clitoris itself doesn't really work because the muscles are shut down. So that is one thing that a pelvic floor physical therapist can help you do, is to help open up these muscles, get these muscles working for you so that then you're able to stimulate your clitoris and experience pleasure itself. In our clinic, we also use regenerative tools to help get that stimulation and get the blood flow, get the muscles working and get the muscles healthy so that they can experience that stimulation. But the clitoris is a really important part, and it usually sits underneath the labia. So you have what we call your labia minora and your labia majora. Your labia majora are what you think of when you think of like the lips of the vagina. These tend to be the bigger lips. They're on the outside of the vagina, and then on the inside, and then if you retract those lips and you take a mirror and you look at your own anatomy, what you'll then see is the labia minora. And those are the little smaller lips on the inside. Now, some people's labia minora are bigger than their labia majora, and so their vaginas might look, or their vulvas might look a little bit more open. And again, it's just a variation of what is normal, and nothing is right or wrong or more pretty or less pretty. It's just the realities of all of our faces are different. All of our vaginas and our vulvas are different. And so that is the makeup of what consists of the vulva itself. Now, if we go a little lower, and we look at the vaginal opening, so the vaginal opening is just the opening to the canal of the vagina. When you go inside the canal of the vagina, if you keep going up, what you will find is a cervix at the top of the vagina. Now, the cervix is the very structure that opens and closes when you have a baby. So when you have a baby, the cervix has to open for the baby to come down and descend out of the uterus. So the cervix has to open and close, and it will open for the baby to descend out when you're in labor, and then it closes and retracts again. And now what also has to happen is, so that cervix is then connected to the uterus. The cervix is the bottom of the uterus. So if you are going in for a pap smear, or you're going in for a colposcopy, and they are checking the cells around your uterus, or removing some cells around the cervix itself, what they're doing is they are spreading the vaginal canal open in order to get up to the cervix itself. Now, the cervix itself feels kind of like a maraschino cherry, if you know what those are, the little cherries that you get when you get like a Shirley Temple at a Mexican restaurant or at whatever restaurants serve Shirley Temples. It's those little cherries that are inside those drinks, and that's typically what the cervix feels like. So you technically can go and feel your own cervix if you insert a finger through the vaginal canal. And now some people can feel them, some people can't. Some cervixes are really high up in the vaginal canal. Some cervixes are lower in the vaginal canal. Sometimes people will have a uterine prolapse, and that's where their uterus starts to descend. And so their cervix might be really low, and sometimes it might descend all the way out of their vagina. And so they'll use pelvic floor physical therapy in order to help bring their cervix back up into place and reduce the degree of their prolapse and or have surgery to fix that. And so that is the cervix itself. So I'm combining this with a little bit of diagnosis, so I hope it's not too confusing. But if you go up through the vaginal canal, you will feel the maraschino cherry at the very top of the canal, and that is your cervix. And then if we come back out of the canal, and then you're at the base of the vagina again, if we come out right between the anus and the vagina, we are going to have the perineal body. Now, the perineal body can feel good to stimulate. It can also, it's just an area. If it's really descended, you could have a little bit of what's called a prolapse there, and that could be what we call a perineal prolapse. It's just where the central tendon, the tendon that runs behind the perineal body, might be ruptured. And so you might feel like if you bulge really, you have a bulge between your anus and your vagina, you might have a perineal. And that's okay. There's things that you can do to help restore the integrity of that type of prolapse and help improve that prolapse. And so that's the perineal body itself. Now, if we go a little bit more south or toward the backside, we're going to see the anus itself. So the anus is a circular structure, and on the outside of the anus, we have the external anal sphincter. And then if you open the anus up a little bit, or you go a little higher up into the anus, you will have your internal anal sphincter. And so those are what helps keep the anus closed. Now, we have a ton of nerve endings right at the opening of the anus. These nerve endings can be pleasurable. They can experience pressure. They can experience touch. And so that's where people can get a lot of pleasure from anal play. And that's where like anal play and like having sexual experiences that involve the anus can feel really, really good and pleasurable. And there's nothing wrong about that. That is a very common thing. But in our society, we tend to be like, no, anal sex is bad. Everything around the anus is bad. But reality is like, there's a lot of pleasure endings there. So there's a lot of pleasure to be had there. And that's not right or wrong. And so again, this podcast is no judgment. I just want you familiar with your body. And so we have vaginal opening, we have anus, then we have the urethra, and then we have the clitoris. These are some pretty epic landmarks. And then you have, again, we went through the labia majora, we went through the labia minora, which are the inside lips. And now what I want to talk about are the muscular structures of the pelvic floor. The pelvic floor controls all these openings and all of these structures, okay? So the anus, of course, not just for pleasure, but also for bowel movements, pooping and releasing gas. Vagina, not just for penetrative intercourse or penetrative anything, but also for stretching and opening and having babies. Urethra, mainly just for peeing and eliminating urine. And then clitoris, of course, is for pleasure and good stimulation, okay? And so these are all controlled by muscles. The muscles that you see here, and if you're watching on YouTube, you will see are the first layer of pelvic floor muscles. So we have different layers of the muscles. There are 3 different layers of muscles. The very first layer is very superficial. And again, that will control a lot of the orgasm, and because the clitoris is embedded in that first layer of tissue. But you have to have a really good function of all 3 layers of these muscles in order to be able to have no difficulty with passing gas or pooping or constipation. You have to have really good pelvic floor muscles so you can spread open and have a great vaginal delivery without tearing a bunch, without creating prolapse or other dysfunctions. You need to have a really good healthy pelvic floor so you can have control of your urine, so you're not leaking a bunch or you're not having a ton of urgency where you feel like you have to pee all the time. You have to have really good pelvic floor function in order to have orgasms. We work with a lot of people that struggle to have orgasms because they just don't have good pelvic floor muscles. When I'm talking about a healthy pelvic floor is a pelvic floor that can fully relax. It's a pelvic floor that can fully overstretch, and it's a pelvic floor that can fully contract. And when we have that kind of range of motion in the muscles, then we have a ton of blood flow, then we have really healthy tissue, and we have muscles that can create good orgasms, because those are how we, create an orgasm. If you have a really tight and contracted pelvic floor, what can happen is that because you are trying to engage the orgasm and stimulate those muscles, but you're already contracted, you're working so hard that it's hard to get that climax and that elevation because you're already fully contracted. So you have to be able to start from a relaxed position in order to get that maximum contraction. So a lot of people are walking around with really tight pelvic floors and pelvic floors that don't have a lot of movement because either they've had babies and they have a lot of scar tissue that is restricting that movement, or they have a lot of stress that is preventing them from having movement in that pelvic floor. These are just really common things that create dysfunction. A lot of people have GI issues that create a ton of tightness through the pelvic floor, which then limit the ability to get that full range of motion. So those are just some of the pieces of the puzzle that can happen that affect the pelvic floor function. So that's the very first layer. The second layer is fascia and some urethral sphincters. The third layer are these deep pelvic floor muscles. So if you're looking online, it's what's called the levator ani muscles. It's a blanket of muscles that create a bowl-like position. And that bowl also has to be able to open, stretch, overstretch, and contract. And a lot of times, again, this third layer gets very constricted and very tight with chronic stress, with a lot of sitting, with a lot of overexercise, and just the mere fact that we're never taught about our pelvic anatomy. And a lot of times we're just crossing our legs, or we don't even know how to control these muscles. And so we just lose connection to them and they become dormant in our bodies. And so we have to stimulate and open up these muscles, get them working for us so we can have really truly healthy pelvises, pelvic anatomy, vaginas, pelvic floor muscles. And therefore, if these muscles are healthy and we have healthy pelvic floors and healthy pelvises, then we also end up having really healthy cores. And when you have a healthy core, what happens is that the rest of your body tends to be a lot healthier, right? So if your core is nice and strong, you are protecting your joints, you're decreasing your susceptibility to injury, and therefore you're usually living with a lot less pain and just feel a lot better in your body. So that is what the pelvis is. That is the container of the pelvic floor. That is the container of the pelvic anatomy. I hope that you have learned something in this episode, a little bit more about your own anatomy. It is okay to touch yourself. It is okay to look at a mirror and be like, explore what this is. If you have no idea and you're literally scared of what it looks like, go talk to a pelvic floor physical therapist, someone who can help normalize your anatomy and then also teach you how to use it. We are just not taught as children how to use our pelvic floors, and so therefore we're just so disconnected with this area. And there's no reason to be disconnected. The more connected we are with our own anatomy, the better our sex lives, the better our birth experiences, the better our postpartum recovery, the better we thrive through midlife, the less injections we need, the less bladder surgeries we need, the less joint replacements we need. So there you have it. I hope you now fully understand your pelvic anatomy, and if you don't, contact us and let's get you in for a consultation. But I am Dr. Allison Feldt, owner of Body Motion Physical Therapy, and you can check us out at bodymotionpt.com. And we have tons of content on YouTube. So go check us out, like and subscribe to us on YouTube. And I hope you enjoyed this episode of the Edmonds Moms Room podcast, a little bit about how your vagina and your vulva function and the anatomy of how it all works together. Thanks for being here. Take care.